I'm just going to give everyone a moment to join here. Okay. So thanks so much for joining us here today. My name is Julie Challoner. I'm an associate director here at the Mass College of Pharmacy. I represent the accelerated program at our Worcester campus. I'm joined by some of my colleagues here today. I'm going to pass it over to them so they can introduce themselves. And so I'll just go around. I'll go over to Courtney, who is one of my colleagues with the accelerated program, and then over to Ryan, and then we get some students and a faculty member.
Yeah, hi everybody. It's so good to see you here today. My name is Courtney Bibbo, and I work in the admission office over at our Manchester campus. So if you're applying to the accelerated program in New Hampshire, you'll be working with me.
And I'm Ryan Dana. I'm an assistant director over on our Boston campus. So if you're looking for the direct entry or traditional professional phase, I'll be working with you over on the Boston campus.
And then we're joined by a faculty member, Dr. Conway-Allen.
Hi there, my name is Dr. Conway-Allen. I'm an associate professor of pharmacy practice through the School of Pharmacy, Worcester, Manchester, and I'm located on the Worcester campus.
And then I'm joined by two students. I'll have Marjorie and then Sierra introduce themselves.
Hi everyone, my name is Marjorie. I am a P3 student and I am on the Manchester campus.
Hi, my name's Sierra. I am a P2 and I'm also on the Manchester campus.
Okay, great. So the way today is going to work, we have a couple of slides about just some information in terms of pharmacy in general, as well as how to apply. And we're also going to be asking our students and our faculty members some questions about the program and things that we offer here. If you have any questions, please pop them into the Q&A box and we'll answer them as we go along. Do not feel like you need to wait till the end to do that. We definitely are happy to answer them as we head along here through our little presentation. So just to get started, we have some quick fast facts about pharmacy, just in terms of what you can expect. We have the median annual wage there from the U.S. Bureau of Labor Statistics. And then just for MCPHS itself, we are rated number 3 for return on investment by the Georgetown University Center on Education and the Workforce. And then we're just one of the top 5 pharmaceutical science programs. I'm not going to go into that too much as we're going to cover more about our program and what our students, their point of view and things like that in a couple minutes. But just to get started, I want to turn it over to Dr. Conway-Allen to talk a little bit about kind of just what does the pharmacy landscape currently look like, particularly after now that the pandemic has waned.
All right, excellent. So yeah, so obviously the numbers on the screen are very promising. Number 3 for return on investment, that's wonderful. But so you might be wondering, well, what are pharmacists actually doing? What does the world of pharmacy look like just in the United States in general? And so needless to say, with the pandemic, the doors opened up quite a bit in regards to what pharmacists were doing, or at least what the rest of the world sort of got to realize that pharmacists do. So our pharmacists are immunizing, they're providing one-on-one counseling for patients that during the pandemic, a lot of individuals were not necessarily comfortable going into doctors' offices. And so they were really reaching out to the most accessible healthcare professional or provider, which is a pharmacist. So in addition to us having expanding roles in the world of immunizations and vaccinations, pharmacists are also on in various different areas of pharmacy. So they're working in hospitals, they're in outpatient centers, they're specialized. And so they are more, they're not just being a part of a healthcare team, but they're actually those a healthcare provider that's making decisions. Collaborative practice is something that is booming right now in the world of pharmacy. And essentially what this means is that pharmacists are writing protocols for medications. They're making adjustments for patients that are on insulin or medication for their hypertension or high blood pressure. And so the pharmacist is actually in more and more healthcare settings. We are given more and more, or not given, but we are actually taking a hold of more and more responsibility. We are pushing for pharmacists pharmacists to be involved with the legislative sort of areas in regards to what pharmacists can bring to the table and how that needs to, convey itself in regards to a national standard. So there's so many different things going on with the world of pharmacy and with pharmacists, and essentially it's ever expanding. And since the pandemic has finally, knock on wood, sort of released its grasps, at least the grasp that it had years ago, we're now able to show the world that what we did during the pandemic, we're now able to do for all, conditions, all disease states, all different areas of pharmacy, all different areas of healthcare.
We do have 3 locations, as we mentioned earlier. There's 3 counselors here on this call that introduce themselves for all 3 locations. We have a Boston location that Ryan represents. It was founded in 1823, and we have about 4,500 students there. That is going to be more of your traditional 4-year pharmacy program if you already have some college coursework, or if you're somebody who happens to be viewing this and is coming out of high school, or maybe just starting out in college, you can also enter in there and complete the entire program out there. We also offer Worcester and Manchester location. That's where we offered our accelerated program. It is the same on both campuses. The main difference is just a physical location. So Worcester was founded in 2000 with about 1,600 students, and Manchester was founded in 2002 with about 500 students. So we do have 2 students here today. They actually both represent the Manchester campus, but I'm just going to have them give a little elaboration on kind of their favorite parts of the Manchester campus and maybe why they chose to attend that particular campus. So we can start with Marjorie and then go to Sierra.
Yes, so I am from the wonderful state of Vermont, and New Hampshire is basically the sister state to Vermont. So I was wanting to stay in New England. And when I visited the Manchester campus, I saw I visited before the pandemic. So I was really able to see the in-person relationship that the professors and the students had. And I really wanted that close connection and network with my professors. And that's why I chose the Manchester campus. And something that I really enjoy about the campus is all the little study rooms that you can find, and that the library is really big and always cold, which is perfect for me in studying. And it's really easy to walk and get yourself a sandwich or a smoothie in between classes.
Yeah, so I also am on the Manchester campus. I lived in Manchester prior to learning about MCPHS, and it just worked out. I didn't have a lot of money to be able to move, and I've already, been experienced in this area. It's like a little city. It's just perfect. Like Marjorie said, being able to walk down the street and get a sandwich for lunch is great. And learning that, this is just such an accessible campus was just perfect for me, and I really enjoyed it. So
I can comment too, Julie, if you'd like, about Worcester. So I actually did graduate from the Worcester campus. So Worcester, MCPHS Worcester is my alma mater. I graduated quite a few years ago. So we have since expanded quite a bit. But I can just very briefly tell you that Worcester it's the second largest city in New England, second behind Boston. I know we fight back and forth between Providence and Worcester, but I'm not sure where we fall right now, but we're either the second or the third largest. In addition to it being a city, though, it does have a small town feel in that, chain restaurants and things like that, not super common around here. There's a lot of small businesses, independently owned restaurants and shops, and so many different places that are in walking distance from the campus. There's the DCU Center where there are concerts and conferences, or different expos and things like that. I'm actually going tonight to go and take my father to see a concert at the Hanover Theater right up the road, right in downtown Worcester, which we bought on a whim this weekend. There's also the Woo Sox, so the Worcester Red Sox. I am also a season ticket holder for the Worcester Red Sox. As you can tell, I very much love my city of Worcester. There's a lot of restaurants, a lot of food, a lot of culture. There's literal murals painted all over buildings that are from local artists. And so although it is a very large city, it is still similar to Manchester, just in a little bit different size-wise, right? But it still has that small town feel. And then the fact that the Worcester campus, we started off with one building when I was a student, a second building opened. And since then, we've purchased a hotel, another building, a block, etc. And so we really have it's a wonderful location being down in Worcester. Again, it is a city, but still has that sort of small town feel and so many different things to do.
All right, and just to go over a little bit more about the program. So on our Boston campus, again, we do have the direct entry PharmD program, where if you are coming straight from high school, you can take all the pre-professional courses with us. If you do have all the prerequisites complete to join our professional entry, it would be a 4-year professional phase. So just going the traditional fall and spring semesters. There also is an honors program available for anyone interested. But again, this campus, it does have summers off. So it would either be, a 6-year program if you don't have the pre-professional coursework yet, or a 4-year program if you're joining right at the professional level.
And then the accelerated program is offered, as we've talked about many times, Worcester and Manchester. It's 2 years of didactic classroom-based learning and then 10 months of advanced rotations for a total of 34 months. This is professional entry only, so you do need to have the required prerequisites to start this program. If you don't, but you want to get started right away, Boston is going to be your better fit there. The one thing I like to highlight is that, again, the program is the same in Worcester and Manchester in terms of the curriculum and kind of the experience that you're going to be getting in terms of the classroom offerings. Really, the only difference is the physical location. So you do want to apply to the location that you're most interested in, because you're going to get the same experience from a didactic-based learning aspect. So please do not apply to both campuses or all 3 campuses, as Ryan or myself will be reaching out, or Courtney, depending on how you fall, to kind of find out which campus you're most interested in. So now we're going to turn it over. Like I said, we're going to have a couple questions for our panel here, our faculty member and the students, just to learn more about the program here. So one of the things that we do a lot here at MCPHS is interprofessional education. It's something that our students really enjoy and that our faculty are actively involved in. So let's just talk about a little about the IPE experiences that we have here. So Sierra, do you want to start?
For IPE experience, we had an experience recently where we got to, talk about a book that we read with OT students, PAs, pharmacy assistants, and nursing students, and we kind of got to go over how our different experiences kind of intermesh with each other, where one person's responsibility would end and how somebody else would take over. And it was just really interesting to see how, each section's minds work. It was a very interesting experience. I enjoyed a lot.
Marjorie, I know you've done a couple of different IP experiences since you're in your 3rd year when you were here for 2 years on campus.
Yeah, so my favorite was I forget if it was spring or summer of my P2 year. Time flies by, where we got to do Narcan training. So Narcan is used to reverse opioid overdoses. And so we did it in person, which my first one had been over Zoom. So that was really nice. And so on the Manchester campus, we also have the PA program, OT, and nursing. So we were able to interact with the OTs and the PAs and just discuss, we went over cases in terms of, okay, you see a patient being presented. What do you do? What are the processes? What is everybody thinking in terms of being able to give a patient Narcan or giving them Narcan access? And it was really cool to be able to learn more about what their thinking process was, especially the PA students hadn't learned opioids yet. So the other pharmacy student and I kind of were able to provide some insight, especially into the world of pharmacy, because there were a lot of things that were like, oh, you just work in the community at like a Hannaford. And we said, no, we also are in hospitals. So it's a really great opportunity to provide them more information about pharmacists and also learn what they're doing and like their thought processes, especially the OT, because I hadn't thought about how an OT would be a part of a Narcan situation. So I really find them really valuable. They've set me up for a lot of success on my advanced rotations, which I'm on now, because you really do work closely with other medical professionals. So they're really fun and just a really great way to be prepared and set yourself up for success in the real world.
Great. So one of the questions that we get a lot here when students come to, I think, interview, and I think we, even just in these presentations or at events, is about clinical rotations. So I know Sierra has done her initial rotations. Marjorie's on her advanced rotations here. So I just want to turn it over to them to kind of talk a little bit about their experiences, because Marjorie is doing a longitudinal, so she can talk about kind of how that's different. And then I'll turn it over to Dr. Conway-Allen to maybe highlight some things that the students didn't bring up because they haven't experienced them yet. So Sierra, you want to start off with maybe where you did your IPPs to start?
So for my IPPY rotation, which is intermediate rounds, I first did around at a community pharmacy in Hannaford. I already work in a community pharmacy, so that was pretty cool. Just filling prescriptions, getting to interact with patients, doing vaccine clinics. And then for my second round, I was at Southern New Hampshire Medical Center in Nashua. That one was honestly my favorite of the two. I got to do calculations on how to prep IV bags, watch how pharmacists do rounds in the ICU, how they monitor patients in behavioral unit or on different floors, and how they interact with the nurses and the doctors to really be a part of the patient's care. And it was such an eye-opening experience. Like, prior to coming to MCP, I kind of just thought pharmacists were in the community setting, just filling pills all day or filling prescriptions all day. So it was very eye-opening and just a great experience. I liked it.
Yeah, so I am now in my advanced rotations, which we call APPIs. And so I chose to do a longitudinal, which means that I will be doing each of my six-week rotations at the same site, which I applied and was placed in my top #1 spot, which was the Dartmouth Hitchcock Medical Center. So I'm doing all of them here. I'm currently in my 3rd week of my 3rd one, and I'm really enjoying it because since I'm in the same spot, I get to see the same pharmacist. So like I was in the same office as my first preceptor today, but I'm with my 3rd one and being able to see how the different positions all work together. And I'm also able to see how Dartmouth works from an outpatient perspective and an inpatient. So I'm currently on my anticoagulation elective rotation, which is really cool because the pharmacists actually are in charge of all of the warfarin dosing. So I get to look at, okay, what's going on with the patient? I think we should give them X amount of milligrams, and here's why. I'm looking at the drug interactions, I'm looking at their liver function and everything like that. And I'm really getting to apply my full 2 years of learning, and it helps solidify the stuff that I learned in class because, okay, we learned about what all this is, but now I actually get to see it. So it makes it like really stick and see how I'm able to have an impact here.
Those are excellent, excellent, Marjorie and Sierra. I'm so glad you've had wonderful experiences and are having great experiences on your rotation. So really, some really great thoughts. And actually, Marjorie, what you just highlighted right there about the warfarin. So for those that are in attendance, so that's for anticoagulation. Basically, after someone has a heart attack or a stroke, or basically they need to thin their blood, and it requires a lot of monitoring. And prior to us telling you that now, or for you, prior to you being a pharmacy student, you might not be aware that those types of roles exist and that pharmacists are the ones actually leading those healthcare decisions and monitoring those patients. Because again, most typically, even though the amount of work and what exactly is being done in our community pharmacies is tremendous, the general public doesn't quite understand what the pharmacist's job and responsibilities and role really is. And so it's really wonderful that you guys are having these eye-opening experiences on your rotations. It's so great. So I'll just sort of mention that essentially you take 4 required rotations, a community an institutional, which is what Sierra was describing with preparing IV bags and being a part of the actual hospital pharmacy. And then you would have internal medicine, which is where you, again, what Marjorie and Sierra kind of described here, right? Rounding on the different floors, being a part of the medical team with the nurses, with the physicians, with other students, with behavioral health, and being a part of that team and addressing those patients, be it in the ICU or maybe they're there for a day stay, whatever it might be. But the pharmacist role there in the internal medicine area is essentially being that pharmacist that's being a part of that team actively outside of the pharmacy, of the actual pharmacy. You'd also have ambulatory care. That's what I do at my health center. So essentially, we think of ambulatory care, you think of patients arriving for an appointment and then patients leaving after their appointment, and everything else that happens in between might not seem that interesting. But if you have a person that has 10 disease states and they're on 30 meds, you can see how involved the pharmacy students that I have on rotation with me, how involved they get to be with doing medication reviews, counseling patients. We do what we have a comprehensive care team visits where we actually meet with social workers, behavioral health, physicians, the patient, their caretaker, we're the pharmacy team, and we chat for an hour to try to maximize their quality of life and improve their patient outcomes. So these are all some general, really exciting things that you'll do on rotations. And they'll happen either within those 4 rotations, the core rotations, required rotation types, or then you have the 2 elective rotations, which, as Marjorie mentioned, she's doing one in anti-coag. You might also do another internal medicine, but maybe it's a specialty. So maybe you're doing a rotation in psychiatry or oncology, which is cancer, or maybe it's pediatrics, or maybe it's cardiology, or maybe it's med safety. Maybe you're at the FDA. Maybe you're at the VA hospital. Maybe you're fill in the blank. And so there are many, many opportunities in regards to different clinical sites and rotations. And the students essentially get to select some of their preferences after they can, meet with and chat with different faculty preceptors, get an idea about what to come for their rotations. And then when they're placed, then they'll have those 6-week rotations, both at the start of your second year and then throughout your entire 3rd year. So many opportunities, and I get very excited if you can't tell. I love talking about it.
Thank you so much for that detailed explanation. Hopefully it helps some of these participants who are viewing this, not really sure what kind of pharmacist they want to be, know that they'll have plenty of opportunity to explore that in a pharmacy program. The other thing that our students are actively involved in here, of course, they're attending classes, they're going out on rotations, but they also have the opportunity to join professional student groups or other student groups here on campus. I know Marjorie's been involved in some with her time when she was here in Manchester, and I think Sierra has also been involved in a group since she's now a second-year student. So I'll turn over to them, Marjorie and then Sierra, to talk kind of like how they got involved when they were on campus or as they are currently on campus.
Yeah, so I joined APHA, which stands for the American Pharmacists Association, which is kind of just like one of the bigger pharmacist associations in the country, because I wasn't really sure what I was thinking about what I wanted to do when I first joined, and it seemed like a great place to start. What we've done is we have gone to the YMCA in Manchester to be able to do some clinics. So I was able to go and do some community service and give blood pressure readings to individuals, which I didn't know until I learned how in class that pharmacists learn how to take blood pressure, and I have my own stethoscope. So that was an organization I was an active part of when I was on campus. And then one that I am actually a part of still, even though I'm not on campus, is I am a member of Rho Chi, which is the Pharmacist Honor Society. So I was able to achieve the GPA and was in the top percentage of the class to be able to join. So I am the treasurer of that organization on the Manchester campus that works closely with Worcester, and Dr. Conway-Allen is the Worcester advisor. So something that we are doing this upcoming, at the end of the month actually, is we will be writing holiday cards to some of the local residents of one of the nursing homes locally. So we'll be writing them holiday cards and just sending them some ornaments to send them some holiday cheer, to let them, individuals of our community, of our Manchester community, know that we're thinking of them from local pharmacy school.
So I'm involved in a few organizations. One that I can really speak about is Sparta. I am one of the officers for Sparta, and it's primarily focused on medications in the community. So one of our events that we do is a drug take back program. So if someone, gets taken off of a medication that they don't need to take anymore, a lot of people don't know really what to do with it. So rather than flushing it down the toilet, you can either bring it to a take back event, or, some local pharmacies have drop boxes for narcotics. You can take it to the police station or hospitals. So just providing a community event for, everyone to bring in their medications that they don't need anymore to be disposed of in a safe manner, I think is really important. And, people coming into that can get some information about what we do as pharmacists and get to know future healthcare professionals.
Great. So you can find our curriculum online if you're interested in exactly how the classes are going to break out for both the traditional four-year program and the accelerated program. But built into our curriculum, we do have the ability for students to opt into different types of electives. And I know some of them are certificate-based. So I'm going to turn it over. I'm not sure if any of our students did any of these, but I'm going to turn it over to Dr. Conway-Allen to maybe talk about some of the electives that our students can participate in if they so choose, because there is a wide variety available to students, and some things you may not be aware of.
So elective courses take place at two different times in your academics here. The first being in the summer of your first year, and then the second being in the spring of your second year. And so the electives are different for first years versus second year students, of course, based off of just general knowledge and where they are in their pharmacy related careers. And so some of the summer electives, or the summer P1 electives, I alternate every other year between an elective called Drugs of Abuse, which is essentially discussing substance use and misuse, abstinence and recovery, all of the different medications that might be misused, or illicit substances, et cetera. And then I also alternate between a drug interactions elective every other year. In addition to that, P1 electives might include directed study. So you might actually do research with a faculty member. You might do research with someone like myself, who's an actual pharmacist faculty member, pharmacy practice, meaning I'm a practicing pharmacist. But then there's a great deal of research that you can do with our pharmaceutical science faculty. Those are your PhDs in pharmacology, toxicology, medicinal chemistry, et cetera. They do a lot of research with, cancer research is one particular track that individuals like to get involved with. And then that would be, both of their electives would likely involve their research there. Other electives might include well-being and resilience, ambulatory care, or emergency pharmacy related issues. There might be oncology. There might be a geriatric elective. Some of these electives will specifically tie into some of those additional tracks or certificate programs. So if you're specifically trying to get a certificate in health management or something along those lines, you might have particular electives that you need to take that are more in the public health realm of things or in the business management realm of things. And so sometimes those electives are sort of laid out for you based off of any type of track, research program, or dual certificate program that you're actually enrolled in. And then everyone else can still pick whatever electives they're interested in. Again, I remember when I was a student, I did a health literacy elective. I still remember to this day, and took the drugs of abuse elective that I now coordinate. But there are quite a few different opportunities in regards to electives in your academics. And then on rotations, some of those elective rotations might be different areas that I've already mentioned previously, but they could also be continued research. If you were trying to specifically go down a track where you took the biotech or the industry elective, so you want to learn more about pharma, like pharmaceutical companies and drug development, some of your rotations you might even be able to apply to coincide with that as well. And so a great deal of opportunity, and luckily we do provide that information for you, from the get-go, so that you can start sort of planning out what you decide to do with your academics. And again, I also just want to highlight, I am talking specifically about the Worcester-Manchester program here. But those certificate programs and corresponding electives would be all mapped out for individuals from the get-go so that you would be able to make your decisions. In addition to that, an immunization certification is also incorporated into your curriculum. And then there are other certificate programs that are optional. And so might not have been optional initially, Marjorie, I think for you is embedded, but so MTM, which is medication therapy management, as well as diabetes education certificates are also incorporated and available for our students as well.
And those, if anyone here happens to be interested in the Boston campus, they also have many opportunities. Ryan could get you in touch, but I know that they have research opportunities. We have a life science institute, and those students can also get involved with different avenues there as well. It's not necessarily that only the accelerated program offers certain things or only the Boston program. The one thing I do want to highlight is that Boston does offer an honors program where Worcester and Manchester does not. And the other thing is that Worcester and Manchester does offer a dual degree in the Master's of Public Health and Boston does not. Those are just some small nuances. Again, I don't think it's going to really make or break your decision there, but just to be clear on kind of a couple differences between the different programs here. I know that Marjorie, like she said, she was in her she's in her final year of the program. She'll graduate here in May. And I wanted to see if she had given any thought to what she is thinking about doing after she graduates, since that, May will be just here around the corner very soon.
It's so soon. So post-graduation, I am going to be pursuing work. I would like to just start jumping right in, becoming a pharmacist and applying all my knowledge. I would really like to work in a hospital. So a barrier I might face is a lot of people who want to work in a hospital do a residency. A residency is just it's a year or two after school where you can specialize, and it's very much heavily focused on generally hospital pharmacy. I want to potentially work in a smaller hospital where that might not be needed, or even just start at the bottom of the totem pole and work my way up. Maybe I'll work here. Maybe I'll work at a smaller hospital in my hometown in Vermont. But I'm really ready to work and dive right into it and just be providing care to patients and interacting with them.
Great, thank you so much. And there is a fair amount of our students who have Marjorie's viewpoint. They want to go out, they want to get a job, they network on their rotations, particularly if they're thinking about going into community pharmacy, at least to start. And then there also is a fair amount of students who do pursue advanced education afterwards in our programs. And I know we do have some students who stay, I think, and do a fellowship right here at MCPHS. We've had some students do that as well. So there is lots of options available to our students once they kind of get to that point in their program.
All right, and how to apply. So for our students that are looking for professional entry to really any of the three campuses, you'll want to apply through PharmCast. Once you do fill out your PharmCast, and you'll, of course, again, submit it to only the location that you most want, then we'll be able to start reviewing your candidacy to potentially get into the program. Some things that you'll need to have prepared for PharmCast. You will need transcripts from every school you've attended. If you have attended a few different schools, you'll need to submit all of those to PharmCast. If you have any international transcripts, you'll need to get those translated and evaluated to US standards. We recommend that they go through WES, WES. We do require one letter of recommendation. That could be from an academic source, a professional source, or you could submit one from both. If you want to submit more than one letter of recommendation, you're certainly welcome to, and we will consider all of the ones that you do submit, but there's only a requirement for one. You will also have a personal statement. The prompt is on PharmCast, so you can take a look at it there if you want to, but it's really, a lot of it's asking you, why you want to pursue pharmacy. So that would be a part of your application process as well. For any non-native English speakers, we may require an English language proficiency exam. We accept a wide variety of them: TOEFLs, Duolingo, The corresponding scores that you would need for any of those exams are on our website. You can also let us know if you have any questions on that, if that applies to you, and we're certainly happy to kind of walk you through your options there. Also important to note that PCAT is not required. But then again, once you finish this and once you submit your PharmCast, we're rolling admissions, so we'll start reviewing right away. A few other important things to note when we're talking about application. So technically, the PharmCast application deadline is June 1st. I certainly recommend applying, kind of as soon as you're ready to. If you want to apply for the fall 2024 entry, you can apply now. I know fall grades are coming in soon, so if you want to wait until those are done and then apply, you can certainly apply even if you do have coursework and prerequisites still in progress. That's not a problem at all. Again, I think the earlier that you apply, one, you'll get a decision sooner, and two, a lot of times the merit scholarships may be more readily available. It may be a bit better the earlier that you apply. So if you're thinking about doing so, I definitely recommend, if not starting that process now, that you probably start that as soon as fall grades come in, so that you can, hopefully get through the review process, get through the interview process, and get a decision, in your hands as quickly as possible. We do look at a number of things when reviewing an application, which I'll let our faculty speak to more in just a minute. But we do look at your GPAs, so your cumulative GPA, your science GPA, your prerequisite GPAs. We do look at, and again, this is something that would come up in your personal statement potentially, as well as your interview, but your reasons of, why you want to pursue pharmacy, if you have any experience in pharmacy or in healthcare in general. So we do consider those. And then as far as the prerequisites go, there are a few points that you'll want to note if you're kind of working on finishing those up. For any of the prerequisite coursework that you'll see on our website, it's important that you have a grade of C or higher in those prerequisites for them to count. Also, for our math and science courses, they traditionally have a 10-year expiration. So if they are older than 10 years old, they would be handled on a case-by-case basis, and our committee would review those. And then just once again, if you have in-progress coursework, that's something that we can definitely still evaluate you for a decision while those courses are being finished up. But I'll turn it over really quickly to Dr. Conway-Allen, and if she just wants to maybe elaborate a little bit on what makes a really good applicant when we do receive a PharmCast, that might help a little bit as well.
Yeah, absolutely. Thank you, Ryan. So as Ryan did mention, right, the GPA, of course, is something that it's important because we need to make sure that our students are able to handle academics that are consistent with a doctoral degree. This is a doctorate program, and so yes, it is important that you have done well academically, and if you haven't done well in certain areas or at certain times, being able to really explain that and talk about what happened and what you learned and how you grew from those experiences is definitely something that's important. But being able to talk to how you were able to maintain your strong academics, your study habits, your time management skills, and things like that. Outside of the academics, or excuse me, as part of the academics, it's also, do you have a degree? How many schools did you attend, and did you take full, course load? So if you just take one course per semester for many, many years just to fulfill the prerequisites, that may not be the best preparation when coming into our accelerated doctoral program in the Worcester-Manchester program, or just in the Boston program, which is still the same amount of academics. It's just spread out a little bit longer. So we will want to see what your academics look like, and that includes your GPA, your course load, so how many courses you're taking at a time. If you have a degree that's not required for the Worcester-Manchester program, you do have to just fulfill your prerequisites, but we still want to look at your full academic picture, and we want you to be able to speak to that. Now that part's done, we really do care about you and look at you in a holistic fashion. So what that means is we want to know, yes, about your academics. We also want to know who you are. Why do you want to be a pharmacist? What experiences do you have? What do you write about in your personal statement? What do you write about in the writing sample during your interview? Do you have any experiences that are unrelated to healthcare, but maybe you can extrapolate those ideas or principles or morals or lessons, whatever you've learned, and can you apply that to pharmacy and healthcare? So we do look at the whole picture, the entire person and everything that they've done. But again, it is still very important to try to make sure that you're maintaining some strong academics, not only because then you look very favorable for when we're looking at you, but more so that you're better preparing yourself to be successful in a doctoral program. In regards to the interview, most of the interviews, I will say most, Julie, right? Because there are some in-person interviews taking place right now, but most are still virtual. And so some tips for how to conduct a virtual interview or how to be on a virtual interview. First is to treat it like an in-person interview. So you should be dressed professionally. You should not be distracted, trying to make sure that you're in a place where there's good Wi-Fi stability, trying to make sure you're in a place where you're not distracted with people walking behind the camera or behind the computer or walking behind you is always important. Come prepared with questions. You've watched this or you've participated in this. And so that alone has given you a lot of information about our program. And so making sure you come to the interview with questions and with ideas or with any type of thoughts or anything you want to highlight or receive clarification on, you should absolutely bring that up when you're on your interview. Other than that, really be coming to and being prepared to have a conversation with us, right? We're here as faculty interviewing you. Your goal is to come into the program and be successful. Our goal is to welcome people into our program who can be successful and help them be successful. And so during that interview, we really want to have that conversation with you. What was your experience? What were your academics like? How do you want to, what kind of pharmacist do you want to be? Why do you want to be a pharmacist? Why here? And tell me all about how good of a fit you're going to be for this institution. And then I'll tell you all about how this institution is a good fit for you.
Great. And yes, we are primarily doing virtual interviews right now just due to convenience of that. Obviously, people apply from all over the country and beyond. So we don't expect people to fly in here for interviews per se. But if you are local to Worcester or Manchester, and we do offer some local options, that would be an option for you as well, depending on the time of year.
All right, and to go over financial aid and scholarship a little bit. So as far as financial aid goes, I guess the bigger picture, everyone that is admitted to the program is also considered for a merit scholarship. These can vary in size, but a lot of them are, a very good start at financing your education. So again, as I spoke of earlier, I think the earlier you apply, maybe the more favorable the merit scholarship may potentially be. So I definitely recommend doing so as soon as you're ready. And then beyond the merit scholarship, which I should mention, the merit scholarships are renewable throughout the program. So in the Worcester Manchester programs for those 3 years, in Boston for the 4 to 6 years that you might be in the program, depending on where you're starting. But they are renewable, so those would carry over year for you. And then beyond the scholarships, a lot of you may want to apply for through FAFSA for federal aid. For things such as grants and loans. I definitely recommend doing that. I think that really gives our admissions team a bigger picture of, trying to understand how we can help you in that perspective, and really to break down what the ultimate cost will be for you after scholarship and aid, and to really see how we can make this hopefully an affordable option for you. Speaking to that, we do have affordability appointments that once you do receive your decision, once you receive your financial aid package, I certainly recommend signing up for one. We do them, again, in person and virtually over in Boston. But there's something that I think are really helpful for students that may not understand exactly either, what the cost is going to be for them and or, what they should be doing on the financial aid end. We can kind of go over better the numbers with you and the different options that you potentially have in front of you to finance your education. It's probably a 20 to 30-minute appointment. So I certainly recommend it. It'll probably clarify a lot of things for the student on the financial end. All right, and then all our contact info is here. So, again, regardless of what campus you work with, whether it's Worcester, and you most likely will work with Julie over there. Courtney definitely handles most of the applicants over on the Manchester side, or myself in Boston. You'll see all of our contact info on the screen here. You can also find that all on our website. So feel free to reach out if you have questions that maybe didn't know you had today, but think of over the next few days, or really anytime. Definitely reach out to us, and we're happy to help. But I do have one more question. I guess I'll put this out there for everyone. Student and faculty here today. But just to kind of go over, I know we touched on it a little bit, but why pharmacy and why you chose the field? So I guess, I don't know if we want to start with maybe a student, Sierra, and then move on that way. But I think that would be a great question.
Yeah, so originally I wanted to be a doctor. I wanted to be an OBGYN. But I'm not the best when it comes to like bodily fluids, so maybe that wasn't the greatest plan. But pharmacy really still gives me that satisfaction of, being involved in patient care. I love learning about medications and how they work with the body. And there's so many opportunities, and pharmacy is growing as a field itself. There's still new positions being made. So it just seems like such a great field to get involved with, and still being able to help people and fulfill my dream of being able to help heal people.
Oh, yeah, awesome. If Marjorie wants to go next.
Yeah, so I have a master's in pharmacology, and I just thought drugs were so cool. Just learning how they work in the body and all of that, how they interact. And I also really love puzzles, and pharmacy gets to be that. I get to look through patient charts and figure out what type of valve they have. They did that today, and just be able to hunt around and see, like, is there a reason to why this is happening, while also being able to interact with patients. I really like interacting with people. I am a people person, but I also like to be, in an office writing up policies. So pharmacy allows me to do both. And it's also forever expanding. It's something you forever get to learn. There's constantly new drugs, there's constantly updates to everything, and I really like how you can continue to learn as you are in the field and as you progress in the field.
I mean, I'll even give mine. Why not, right? I mean, I'm not a current student. I'm a former student, but I'm still here because I obviously love what I do, and being able to interact with students like Marjorie and Sierra, obviously. But I wanted to become a pharmacist because I wanted the answers. I was working in a CVS, and they needed help back in the pharmacy. I was a front store supervisor, so I started helping here and there. And then it was really just bothering me that I didn't know why a patient should take a certain medication in a certain fashion at a certain time of day, with or without food, spaced out from other meds. I didn't know why they could or could not take this cough syrup over the counter based off of their medication history, because I was a pharmacy technician, or I was an associate helping in the pharmacy, but I was not the pharmacist. And when I would watch the pharmacist counsel, I realized the wealth of information that they had, and I decided that I wanted it. I wanted that information. I wanted to understand everything that pharmacist understood. Thank goodness that's still true, because as Marjorie mentioned, we are constantly learning. There are new drugs all the time. And so it forces you to always have that drive, or that hunger for, I want to know more. I want to have the information. And so for me, it was really, that was a big piece of the puzzle. And then in addition to that, being able to now apply that to take care of patients and help them understand things better, it just made sense to me. So.
Great. Thank you so much, everyone, for that. I do appreciate it. I appreciate everyone joining us here today. I don't see any questions have come in the Q&A box. I'll give it 1 second as we do wrap up. As Ryan mentioned, there's our contact information. We do offer campus tours on all 3 campuses if you are interested in seeing any of our campuses in person prior to applying, or you're just kind of, even if you apply and do a virtual interview, you can still come and tour one of our campuses here. But definitely reach out to us if you have any additional questions. Otherwise, we are going to wrap up here today. Thank you so much for joining us, and we hope to see your applications come through soon.